Hello, everyone. I hope all of you are doing really well. And today, let's talk about another important topic from cardiac anatomy, which are the valves of the heart. Now, basically, the valves of the heart can be divided into two categories. One is the atrioventricular valve, and the second is the semilunar valves. The atrioventricular valves consist of two, which is the mitral valve and the tricuspid valve. As the name suggests, it's called atrioventricular, which is present within the atrium and the ventricle. So that's why the mitral valve and the tricuspid valve can be classified as an atrioventricular valve, whereas on the other hand, the pulmonary valve and the aortic valve are known as the semilunar valves. It's called semilunar because the cusp of both the valves looks like a half moon. So that is why it is called a semilunar valve. Now, let's talk about the functionality of the valves. What does the valves do? So in case of tricuspid, let's start off with the tricuspid valve. The tricuspid valve opens up when the right atrium pumps the blood into the right ventricle, and also when the right ventricle pumps the blood back into the pulmonary arteries. The tricuspid valve remains closed so that there is no backflow, there's no backflow of blood from the right ventricle back into the right atrium. Now, let's talk about the mitral valve. What does the mitral valve do? Oh, by the way, before moving on to mitral valve, let's talk about the clinical relevance of tricuspid valve. Now, you should remember this high yield concept that the tricuspid valve is the most affected valve, which a most affected valve in case of endocarditis caused by IV drug abuse, because the bacteria encounters the tricuspid valve first, so that's why it's most affected valve. On the other hand, let's move on to the mitral valve. Now, the mitral valve is present between the left atrium and the left ventricle. What does the mitral valve do? The mitral valve opens up when the oxygenated blood which arrives from the lungs moves to the left atrium, and then it moves on to the left ventricle. The mitral valve opens up, and also the mitral valve remains closed when the left ventricle is contracting and pushing the blood back into the aorta, so that there is no backflow. Now, what's the clinical relevance of mitral valve? The clinical relevance of mitral valve is that the mitral stenosis can lead to which can lead to mid diastolic murmur, and that can lead to left atrial enlargement, which can eventually cause dysphagia. So that's a very high yield concept which you need to remember. On both aortic valve and the pulmonary valve, which are also known as the semilunar valves, basically the functionality is the same, that the pulmonary valve opens up when the right ventricle pushes the blood from into the pulmonary arteries, and the clinical relevance is that the pulmonary hypertension can lead to pulmonary stenosis and there is another congenital heart disease which is known as tetralogy of Fallot, and that can also lead to pulmonary stenosis, and that can lead to ejection systolic murmur. On the other hand, the aortic valve, simple as that, it opens up and the left ventricle pushes the blood into the aorta. So thank you, everyone.